Hello guys, Dr. Marco here, and today we're going to discuss about prediabetes. Now, prediabetes is a medical condition in which a person has greater than normal glucose levels. Now, it's also called hyperglycemia, and it's basically due to an insulin resistance. Now, insulin resistance is that your cells are not sensitive enough to insulin. Now, the cells, they need insulin so that the glucose or amino acids or certain proteins can enter the cell. When that happens, your glucose in the blood goes into your cells. So the glucose levels in the blood actually falls down and comes back to normal. Once you have a meal, insulin gets released. And the glucose and the amino acids, they actually go into the cell, and that's how your body regulates your glucose levels. But in prediabetes, this fails to happen, or it happens, but the cells are resistant to the insulin. Now, they're not allowing as much glucose as they used to, or as many amino acids as they used to inside the cells. Now, you'd be asking, but why does this happen? This happens because a fatty layer builds up on the cell wall of the cell. That leads to resistance and increased insulin levels. So now your body needs to produce more and more insulin so that the glucose can actually go inside the cell. Now that you know about insulin resistance, let's talk about diabetes and why it happens. So once this insulin resistance goes on and goes on, after a few years, your body has burnt out all of its resources in producing insulin. The beta cells of the pancreas, the islets of Langerhans inside the pancreas has these beta cells, and they produce insulin. So they go through a beta cell burnout. Your body is not producing enough insulin to cater for all that glucose and those amino acids that are coming through your gut. So now what happens? The beta cells going through a burnout. Your body's not producing enough insulin, and the glucose is not entering the cells, leading to hyperglycemia as seen in diabetics. Now, this also happens on a smaller scale in prediabetics due to that insulin resistance. If that happens, you will have persistent high glucose levels. 1 in 3 Americans have prediabetes, and 90% of them, I'm going to say that once again, 90% of them don't know that they have prediabetes. You may be watching this video and thinking, well, do I have prediabetes and not know it? Well, I'll tell you about the risk factors. Now, obesity is a risk factor for prediabetes. If you are overweight and you have a BMI that's higher than 26, let's say, then you fall into that category, and you should get yourself, checked for prediabetes. And the second risk factor is hypertension. If you have blood pressure readings that are greater than 140/90, that's hypertension. And hypertension could be a risk factor for prediabetes. Let's go on to the third risk factors. If you're a woman that has given birth to a child that's greater than 9 pounds of weight, of live birth weight, greater than 9 pounds, that may put you at risk for prediabetes. And if you've had gestational diabetes, means that you have abnormal glucose levels during your gestation or during your pregnancy, that means you're at risk for prediabetes. The fifth thing is, if you have polycystic ovarian syndrome, that may also put you at a risk. Now, there are certain ethnicities that are at a higher risk for prediabetes than other nationalities or other ethnicities. For example, African Americans, they're at a higher risk. Some Asian Americans, they're at a higher risk. If you have ancestry if you have your grandparents or parents that came from Pacific Islands, also known as Pacific Islanders, they're also at a greater risk. Or if you've had your grandparents or your parents or your brother or sister diagnosed with type 2 diabetes, it puts you at a risk for getting diabetes type 2. And before diabetes type 2 comes prediabetes. Now, you'd be thinking, but how do I check? How do I know if I have prediabetes or not? Well, that's easy. You go to your doctor for your routine checkup, and the doctor would, get these tests regularly done. Or if they're not, I'll tell you about that. Now, the HbA1c test, also known as glycated hemoglobin. Glycated hemoglobin, or the HbA1c, is used as a marker to detect your blood glucose level for the past 3 months. Now, if you have a blood glucose, an HbA1c level of less than 5.7%, well, that's normal, nothing to worry about. If you have an HbA1c level of about 5.7 to 6.4, that's the pre-diabetic range. Or some doctors even say 6.6. Well, that's the range for pre-diabetes. And if it's above 6.6, well, that's diabetes. And the other test is fasting blood glucose levels. Now, blood glucose levels, as soon as you wake up, are known as the fasting levels. You need a 12-hour or a 16-hour fast to get those levels checked. And as soon as you wake up, it's the first thing you do. Now, if you have a fasting blood glucose level under 99 or under 100, well, that's normal. If you have about 100 to 125 milligrams per deciliters of fasting blood sugar, well, that's the pre-diabetic range. Above 125, that's diabetes. Now that you know about that, there's another test. The third test is the glucose tolerance test. A doctor or a lab technician would give you an oral glucose sample. You drink it, and after a few times, they check your glucose levels. It's also known as the OGTT test or the oral glucose tolerance test, and that's also a good marker to check if you have prediabetes or not. So after all, you've got all those results in, and you figured out, well, I have prediabetes. Now what do I do? Well, there's good news. Yeah, you'd be thinking, well, I have prediabetes, and Doc Marco says it's good news. Well, yes, it is, because it's reversible. Listen to me carefully. Prediabetes is a reversible condition, yes. Diabetes, on the other hand, is not. If you have prediabetes, the first thing you should do is lose weight. If you lose just 5 to 7% of your weight, that's around 10 to 14 pounds for a 200-pound male, you can actually reverse it. You would reverse your insulin resistance. The insulin levels would come down. Your body would have a much easier time putting that glucose, those amino acids, into your cells. And now you would have normal blood glucose levels. The second thing you can do is quit smoking. If you smoke, now is the best time to quit it. The third thing is you would go on regular walks, or you start exercising. The CDC recommends at least 150 minutes of exercise per week. And the WHO, the World Health Organization, recommends about 90 minutes of strenuous exercise or 170 minutes of brisk walk. If you work out about 30 minutes a day, about 5 times a week, that's 150 minutes. Well, you can easily get 30 minutes out of your schedule for your health. The fourth thing is you would go on a keto diet, a low carb, high fat, high protein diet. Well, you'd be thinking, well, diets don't work. But yeah, we're looking at a specific diet that is designed for your body so that it produces less insulin and decreases your insulin resistance. There are a lot of studies done that show that keto diet or the Atkins diet or any low carb, high fat, high protein diet actually reduces your insulin resistance. So if you go on a keto diet, that's good for you. Well, the fifth thing is intermittent fasting. Now, what is intermittent fasting? It is that you eat for a certain period of the day, but then you fast for a prolonged period. Giving your body rest, not eating food, would actually help cleanse your guts and your toxins, as well as your liver and your blood. Now, if you fast for around 16 hours a day, 16 hours, you have the 8 other hours left to eat. But for the 16 hours, you would not eat anything. That's intermittent fasting. And intermittent fasting has proven to lower the risk of cancer, of heart disease, stroke, as well as diabetes. And that's a very potent tool. Reduce your sugar intake in your coffee, tea, milk, cereal, anything. Hidden sugar is bad. And now the seventh thing is increase your fiber. If you increase your fiber uptake, that would actually slow down the absorption of glucose. And if the glucose is absorbed slowly, well, guess what? Your body has an easier time putting it into the cells. The last thing I would like to say to you is manage your stress. Now, stress increases your cortisol, and the cortisol increases the gluconeogenesis, or the generation of new glucose in your body. One thing to manage stress is actually exercise. The other thing is meditation, thinking deeply, and going out just a walk with your friend, someone you love, giving them time, putting your phone away for 2 hours, or not looking at your phone the first thing in the morning, not thinking about things that you cannot predict, things you don't have control over. Get support from people around you, people that have similar goals. For example, if there is a community around you that's trying to get their health and their lifestyle better, join it. If there's a walk group, go ahead, sign up. That would actually do you a lot of benefit. I hope that you get over this pre-diabetic phase of your life. It's completely reversible, and if someone tells you otherwise, it's just wrong. If you like the video, make sure you give it a thumbs up and you comment down below if you have any queries. I actually read the comments and I try to answer all of them. And if you have any query about your personal health, specifically about pre-diabetic conditions or any other health condition or any other video you'd like me to make, then go ahead and comment down below. Make sure you subscribe and press the bell icon so that you're notified whenever a new video comes up. Take care. Goodbye.